Good day, grade 10 learners. Welcome to our third quarter lesson in health. Last quarter, we discussed about health trends, issues, and concerns in the Philippines. For this quarter, we will discuss about these in a global level. The following objectives: 1. Discusses the significance of global health initiatives. 2. Describes how global health initiatives positively impact people's health in various countries. 3. Analyzes the issues in the implementation of global health initiatives. 4. Recommends ways of adopting global health initiatives to local or national context. Are you familiar with these logos? Can you identify them? For this quarter, we will be discussing about the global health initiatives that different organizations do to address health problems globally. These are the 17 Sustainable Development Goals based on the 2030 Agenda for Sustainable Development. This is adopted by all United Nations members. The SDG is the global blueprint to end poverty, reduce inequality, and to tackle climate change. These are urgent call to action by all countries in a global partnership. Watch the video to understand what each SDG is for.
Did you know that the UN Sustainable Development Goals are a universal call to action that unites 193 countries around the world? If these global goals are fulfilled by 2030, life on Earth will be better for everyone. So, what are these goals? Eliminate poverty in all its forms. No hunger. Everyone should have safe, nutritious, and sufficient food. Everyone has equal access to healthcare, thus ensuring our well-being and a healthy life. Equal access to a quality education. Ensure gender equality where women and girls have the same opportunities as men and boys. By achieving these goals, each member of our society will be equal, safe, and happy. UN global goals also include access to safe drinking water and sanitation, access to clean energy that is safe for people and the environment, sustainable and stable economic growth. Everyone has a decent job, strong infrastructure, and the support of innovations. Lower inequality within and among countries. Cities and settlements be developed without damaging the environment and people. Achieving these goals will result in the well-being of people and our planet. We can further take care of our environment with the following goals: sustainable and safe production and consumption of products. Take urgent measures to reduce climate change and its impact. Ensure the sustainable use and protection of ocean and sea resources. Restore and protect Earth's ecosystems. By achieving these goals, we will form a society where strong institutions ensure peace and justice. It is important for everyone to be involved and to build partnerships for achieving sustainable development goals. You are part of this process. Demand the implementation of these goals. Take the lead and share information with your friends.
Complete the main point of the Sustainable Development Goals by unscrambling the letters given United Nations 2020. Now, let's focus on Sustainable Goal 3, which is to ensure good health and well-being globally. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. End preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. 3. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. 4. Reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. The WHO FCTC provide these following measures to control the tobacco epidemic. Watch this video to have a more detailed knowledge of the Sustainable Development Goal 3.
It requires governments to do many things. First, governments must invest in human resources for health so that there are health workers close to people. They must also invest in a social protection floor so that people who want services can buy services. It's not good enough to have services when they cannot afford it. And the final point is supply chain management system. So if you are going to provide services, you must also provide supplies. So when they need drugs or they need supplies to provide health, they'll be there to do it. I think it's important for us to be able to provide good nutritional advice to young people. So they eat well, balanced diet. They eat enough fruit, they eat enough vegetables, and they have a balanced diet with micronutrients. I think it's important. So those are things that we can do. And young people need to know about their bodies, so comprehensive sexuality education and access to services. So we can prevent many things. And I'll give you an example. Today, the highest incidence of HIV occurs in the adolescent girls in Africa. They are the ones who suffer most. So if we can prevent that and we can give them the information, the knowledge, and the services to prevent it, we'll have done a great thing. I think with government, if government puts their mind to it, yes, because most of the things we're talking about here are things we are doing at this point in time. So governments, civil society, the private sector just need to be a lot more organized. And it's not expensive. It's just the fact that we need motivation and we need leadership and we need political will to put resources where it does matter. And if we do it, we'll get there.
2, 1. Let's talk about numbers. How does 97 million sound? That's the number of deaths we could prevent if the global community makes the right investments in health and health systems over the next 15 years to achieve the health targets in the Sustainable Development Goals, the SDGs. That's 97 million people who would live full, active, and productive lives because they don't die too young. So, what kind of investments do we need to make? Imagine if all countries could employ the health workers they need, build hospitals and clinics in the places they're needed, and provide vaccines and medicines to ensure everyone gets the health care they deserve. The World Health Organization's SDG Health Price Tag estimates the investments needed in 67 countries that make up 75% of the world's population. On top of what they already spend on health, these countries need additional investments of $3.9 trillion over 15 years. That's an extra $58 per person per year by 2030. We know what you're thinking. That's a lot of money. Can the world afford it? Well, yes and no. Most countries have the funds to make these investments if they choose to. But the world's poorest countries face a shortfall of up to $686 billion over 15 years. Those countries will continue to need assistance. Yes, the price of a healthy future might be high, but the cost of doing nothing is higher. Over 15 years, the right investments in health could add 535 million extra years of healthy living to the world's population. How do you put a price on that?
Select a developing country and research about their programs and milestones achieved on the SDG 3 targets we have discussed a while ago. Compare and contrast their achievements with your observations on status of healthcare in the Philippines. Share your findings with your classmates. The WHO Framework Convention on Tobacco Control is a treaty that reaffirms the people's right to the highest standard of health. It is developed in response to the globalized tobacco epidemic. It is one of the first multilateral health agreements to strengthen national legislation and policies on tobacco control and regulation. The WHO FCTC provides these following measures to control the tobacco epidemic. This video highlights the importance of implementing the WHO FCTC. Let us watch the video.
Tobacco use is an epidemic that kills nearly 6 million people a year worldwide. In the Eastern Mediterranean region, 21% of adults on average smoke tobacco, 38% of men, and 4% of women. In some of our countries, however, the proportion of smokers can be as high as 52% among men and 22% among women. Smoking rates among youth are particularly worrying. They can reach 42% among boys and 31% among girls. This includes smoking shisha, which is more popular among youth than cigarettes. Two tools can help us change this: the WHO Framework Convention on Tobacco Control and the Empower policies to reduce tobacco use. Monitor tobacco use and prevention policies, protect people from tobacco smoke, offer help to quit, warn about dangers, enforce bans on tobacco advertising, promotion, and sponsorship, raise taxes on tobacco. WHO estimates that the comprehensive implementation of the WHO Framework Convention on Tobacco Control and the Empower policies to reduce tobacco use in the Eastern Mediterranean region would lead to a reduction in tobacco use ranging from 20 to 40% in 5 years, and in some countries by up to 36% in 5 years and 56% in 15 years. Countries have committed to a set of global targets for reduction in non-communicable diseases to be attained by 2025. One of these targets is a 30% reduction in tobacco use. We need to act now to implement the WHO Framework Convention on Tobacco Control and the Empower policies to reduce tobacco use. We need to act now to fight tobacco and save lives. For more information, go to www.emro.who.int/TFI.
List down the regulations in the Philippines that you think reflects the WHO FCTC. What improvements can be made to enhance implementation of tobacco control and regulation in your locality? The Global Mental Health Action Plan, or the Comprehensive Mental Health Action Plan 2013 to 2020 to 2030 to strengthen effective leadership and governance for mental health. Provide comprehensive, integrated and responsive mental health and social care services in community-based settings, implement strategies for promotion and prevention in mental health, and strengthen information systems, evidence, and research for mental health. Watch this video to have a more detailed knowledge of the Global Mental Action Plan.
Community, we've been quiet. Depression and anxiety disorders affect more than 600 million people around the world. For people suffering, everyday tasks can be difficult. So what are the roadblocks that prevent countries from addressing mental health? Stigma, inadequate funding, and poorly prepared health systems. The cost of lost productivity in the workplace due to depression and anxiety is very high too, over $1 trillion per year. But we also know that treatment for depression and anxiety is a worthwhile investment. Every dollar invested in treatment leads to a return of $4 in better health and ability to work. But governments in low-income countries spend less than 1% of their health budget on mental health. High-income countries invest around 5%. This is a critical time. Globally, only 1 in 5 people who need treatment for depression and anxiety are receiving it. Almost half of the world's poor are expected to live in a country affected by war and violence by 2030. Refugees and people living under such stressful conditions are at an even higher risk for mental health disorders. We also know that such traumatic events can have a major impact on a child's or adolescent's brain development and lasting effects on their health well into adulthood. Without action, the impact on people's mental health is likely to be on a scale we have never seen before. We can solve this by scaling up the work already underway and strengthening political will and leadership, integrating mental health into health systems, and increasing investments from national governments and international development partners. Let's bring this issue out of the shadows. It's time to make mental health a priority now.
Conduct a quick research on mental health statistics in the Philippines and the world. Identify national and global policies addressing mental issues identified. How do you think these initiatives can help in the rising mental health problems? The global strategy to reduce the human harmful use of alcohol is composed of 10 interventions at national level and 4 interventions for global action. The global action includes advocating for public health, capacity building, and technical support for agencies regulating alcohol, production and dissemination of knowledge on harmful effects of alcohol, and resource mobilization. List down the regulations in the Philippines that you think reflects the WHO Framework Convention on Tobacco Control and Global Strategy to reduce the harmful use of alcohol. What do you think would happen to our world if there is no control in the use of tobacco and alcohol? The Global Alliance for Vaccines and Immunizations is a global partnership that promotes immunization for all. Its mission is to save the lives of people as well as protect them by increasing access to immunization. Aside from providing vaccines, Global Alliance for Vaccines and Immunizations also strengthens the capacity of health system to deliver immunization and other health services in a sustainable manner. Watch this video to know more about UNICEF and WHO partnerships for immunization. Global initiatives health address the health trends, issues, and concerns. Different global organizations such as World Health Organization WHO, United Nations, and UNICEF addresses the health concerns such as the tobacco and alcohol use, mental health, and immunization through the participation of the countries. This initiatives will mean nothing if the country is not proactive, and the strategies and programs